This is back to really orthodontics. Well, there's a theory about why did the mouth not grow big enough. There is a genetic component. Some people are genetically inclined to being what we call a class 2, which is kind of a buck tooth, and some people are genetically inclined to being like a bulldog, you know, where the jaw sticks out. But on top of that, there are some environmental factors, and there are theories that breathing correctly, which, that sounds silly, what does that have to do with your mouth? But you should breathe through your nose with your mouth closed and your tongue sitting on the roof of your mouth. Well, that keeps the maxilla, the top jaw, open and big, because you have muscles on the outside pulling down all the time. Well, if you breathe through your mouth instead of your nose, you end up having, you're forced to because you have to breathe, you put your tongue on the floor of the mouth and it never touches the roof. So that's why you get a very high palate and the teeth are sunk in and usually stick out. So I treat many developmentally disabled children with orthodontics because they have this problem in spades. They have severe, like they're breathing incorrectly, swallowing incorrectly, not utilizing their mouth. I have many patients that I have to bring in an anesthesiologist and sedate them to do the placement of the retainers. We use cemented in retainers so they don't come out. And then usually, you know, I check them in between, but they get, so they get the same treatment as anyone else. They're just much more severe. They usually require more appliances. But my philosophy is if I can get them a better shape, they'll have better speech, they'll have better swallowing, they'll have better function, and maybe they'll be able to breathe more correctly.